Hi, everybody. I'm Paris, and my topic was Yersinia pestis, also known as plague, also known as the Black Death. Some of you may know. So, the etiological agent for Yersinia pestis is the intracellular bacterium, Yersinia pestis itself. It's gram negative, cocoa bacillus shaped, and was discovered by Alexander Yersinia in 1894. It primarily affects rodents from fleas and is transmitted to humans through fleas themselves, bites from rodents, direct contact with rodents, infected rodents, or respiratory droplets from infected humans. So there are a few variance factors for Yersinia pestis, but I feel like these two are the most important. One of them being the pH 6 antigen, which causes binding or sticking of the bacteria to cells, which further helps infection and helps the bacteria go unrecognized by cells. And also Yersinia outer proteins or YAPs, and they use a secretory system called TEST, which allows the bacteria to invade neutrophils and macrophages. So there are multiple YAP proteins, but here are just two, just so maybe you can kind of get an understanding of how they actually work. YAP H basically cuts off communication that's essential for phagocytosis and impairs the host cell's ability to engulf the bacteria. And YAP E, which disrupts actin cytoskeleton dynamics, which also inhibits phagocytosis, making it impossible or very hard to engulf the bacteria. So the first pandemic recorded that matched the characteristics of plague was in 541 AD in Rome. It described people suffering from buboes and septicemia. Between 4 years, it spread over multiple continents, killing over 100 million people in Africa, Europe, and Asia. I feel like it's most commonly known for what happened in Europe in the 14th century, which termed the name the Black Death, in which a ship from Asia docked in Italy in 1937, carrying aboard hundreds of infected rats. And it estimates about 25 million people or more died just from 1347 to 1352. So, yeah. In modern times, plague epidemics have occurred in multiple continents, but for the past 30 years, most cases have occurred in Africa. The three most endemic countries are the Democratic Republic of Congo, Madagascar, and Peru. In Madagascar, cases are reported almost every year, and currently around 2,000 cases occur annually with a global fatality rate of 5 to 15%. So, Yersinia pestis is primarily spread through fleas that infest rodents, especially rats. Direct contact or bites from infected animals or inhaling respiratory droplets from other infected humans can transmit this disease to person or, you know, from rat to human. Common symptoms of the plague there are three types, by the way. Bubonic plague refers to the buboes or the painful swellings of lymph nodes that are found in the neck, armpit, and groin region. Skin and tissue become damaged, leading to dark patches. Headaches, nausea, vomiting, and aching joints are also reported symptoms. There's also pneumonic plague, which is the most deadly. It's airborne and spread by coughing or sneezing and can lead to respiratory failure and pneumonia. Symptoms of that include shortness of breath, chest pain, cough, and watery or bloody mucus. Septicemic plague is a deadly blood poisoning caused from the bite of an infected insect, which can potentially lead to gangrene and or organ failure. So currently, general antibiotics such as streptomycin, gentamicin, and doxycycline are effective for treating plague when administered promptly. It's very important that the faster you do it, the better. I'll just say that. So according to CDC, currently, the vaccine is no longer recommended for use in the United States, but plague vaccines have been used since the late 19th century, but their effectiveness has never really been measured precisely or very accurately. So, prevention of plague is to keep food away and out of reach, clear piles of brush, wood, or trash where animals could potentially make home there. Avoid feeding wild animals. Don't let your pets roam free if you are in a known plagued area, and wear gloves if handling a wild animal. And that is it for my presentation. Thank you for listening. Thank you for watching. Hope you learned a little bit about Yersinia pestis because I sure did.